The contents of this program may not necessarily represent the views of Ummah Channel.
Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullahi wa barakatuhu. My name is Shakil, Salam, and you're watching Hamari Sehat, the health show on Ummah Channel, Sky 820. This is the health show looking at various aspects of health and well-being. This is a program for you and for your family. Today we have a guest you have seen numerous times on this show. Very dedicated person, Dr. Ishfaq Ahmad. Assalamu alaikum.
Wa alaikum assalam.
How are you?
I'm fine, thank you, alhamdulillah.
Jazakallah for coming. And if we just say Dr. Ishfaq Ahmad, that's not probably a justice for a wonderful friend, a great consultant. Dr. Ishfaq Ahmad is a consultant gastroenterologist, and he works for Worcestershire NHS Trust, and mashallah he's been here a few times, done various programs from bowel cancer to all aspects of it. So as I said, he's working at the Worcestershire Acute NHS Trust, and I believe that you've been a finalist for NHS Regional Award Doctor of the Year. Is that true?
Yeah, that's true.
So when is the ceremony?
I'm very grateful. I think the last year, if you remember, I was a Physician of Year nominated.
That's for APPS
by
UK.
the Association of Pakistani Physicians and Surgeons. So fortunately this year, in the local NHS regional award scheme, I'm the finalist. And the ceremony is on the 18th of November, which is a little bit tight because my daughter is getting married on the 19th.
Okay, mashallah, that's fantastic. And also, as a very active member of APPS UK, you also, we mentioned about some charity work in Pakistan.
Yeah.
I believe that there is a project already started. Is it mobile clinic?
Mobile clinics, yeah. Yeah, I think mashallah, we have got very dynamic leadership, including Dr. Iqbal, Taimur Mirza, Yaz Asgar, Sayyid Nayyar Abdi. So we have now, mashallah, our project of mobile clinic have started at 2 pilot sites in the remote villages of Pakistan. And we're very, very fortunate, and to our donors as well, that we have raised a significant amount of
And
funds.
if that's not enough, you got another role. I don't know where did you get time from. You are actually chair of matrimonial committee of APPS UK, where all the professional doctors and all that, you arrange their wedding, or you take part in making sure that there are suitable rishtas?
Yes, I think it's a service which I'm honored that our chair has bestowed upon me. It's a matchmaking facility for the professionals, really, because all the professionals of our community are scattered all over the country.
Absolutely.
So it does help them to have an event. We do conduct about 3 events a year, and mashallah, our last event, there were about 6 to 7 families got connected, and the rest is dependent on them to find out what the ins and outs of the both families are. So we are just facilitating the connection between the families.
And that is very brief description and introduction of a fantastic guest today, Dr. Ishfaq Ahmad. What we're going to talk about is abdominal pain and IBS. So if you got any question relating to this topic, please do call us. Give us a call, talk to our guest, and ask questions relating to abdominal pain or IBS. So let's start with, so when we're talking about abdominal pain, what is it? What do we mean by that?
I think the abdominal pain is a very common symptom. So majority of people, including you and me, will suffer at some stage. And the good thing about the abdominal pain is that the vast majority of pain is sort of self-limiting, which will go away within a few days. But it's an issue with when the pain persists and becomes chronic. So there are sort of two types of pain: an acute pain where the pain is only for few days, and the chronic pain where the pain is persistent for few months. So acute pain usually either is a serious or non-serious. Non-serious pain usually settle down after a few days, and obviously if the acute pain is serious, it can go on to some further investigation and diagnosis. And here we're talking today about predominantly of chronic abdominal pain, which is a long-standing and persistent.
So just describe of some of the sign and symptom we need to look into it. So how do you describe that abdominal pain?
I think first of all, if I can tell...
oh, have you got some
so I've got one graph.
All right, okay. It's probably a bit small, but hopefully people can see it.
If it can be focused a little bit. So
hopefully, yeah, we'll focus on you so we can see.
And the abdomen is sort of divided into 7 segments or 7 portions.
So these are the 7 portions.
These are the 7 portions. So it is important to sort of remember which portion we're talking about. If we take from the right upper quadrant, which is on the right upper side of the abdomen, where the liver and the gallbladder is. So the pain in this area will be originating from liver, gallbladder, or sometimes the pain from the pneumonia can also present in the right upper quadrant.
Okay.
Then we move on to the upper part of the abdomen, which is called epigastrium, which is just below this chest bone. And in this part of the abdomen, the stomach, common causes of the stomach pain would be heartburn, stomach ulcer, and also in that area the pancreas also lies behind the stomach. So any inflammation or sometimes cancer of the pancreas can cause pain in this region. Then we're moving on to the left upper quadrant, which is on the left-hand side of the upper part of the abdomen, where the spleen and the kidneys are. So any problem with the spleen or kidney, or like kidney stones, or can cause a problem. Then we move on to the middle portion where the umbilicus is, the middle portion of the abdomen, where commonly the most of the gut-related abdominal pains can happen, like in irritable bowel, in colitis, in Crohn's disease, and also very rarely the ballooning of the major blood vessel can also cause the pain in the center of the abdomen. And then we move on to the right lower part of the abdomen, and here the appendix is there, so that any inflammation of appendix or appendicitis can cause the pain. Any problem with the kidney stones can cause the pain. And in females, any ovarian or uterine problem like uterine fibroids or ovarian cyst can also cause the pain as well. We're moving on to now to the left lower part of the abdomen, and again here the ovarian and uterine problem and some problem with the large bowel inflammation can also cause the pain. And the last region is just above the urinary bladder, where any issues with the urinary tract infections or any inflammation of the large bowel can cause the pain. So I think these are the 7 segments which are important to remember whenever you're going to see the doctor or you're phoning your GP. You need to tell them which part of your abdomen, upper part, middle part, lower part, right or left, the pain is happening, so that the person at the other end, either it's a nurse or a GP, can understand that what the possible underlying problem could be.
Okay, that's fantastic. Just to remind you, Dr. Ishfaq Ahmad is with us, and we're talking about abdominal pain. Pet ka dard? Pet is the right word for, or pet is not, is it?
Yes, I mean, it could be right.
Oh, could be right. Pet is quite a big area to cover, isn't it?
I think that we all work for the PATE anyway.
Yeah, we work for PATE and we're talking about PATE today.
Yeah.
So it is abdominal pain and it is common. I think most of us probably gone through that process.
Correct.
Severity might be slightly different.
Yeah.
So do we need to worry about it if there is a pain, or do you need to wait until it get worse?
Right. Okay. I think there are. We need to worry if it's an acute and if it's severe. The type of pain which you never had, which happens suddenly, I think you need to be worried about it. I mean, there is no point in using any kind of remedies. If you have got severe pain which you had never had it before, the best thing is usually to ring emergency services. Or if there are sort of chronic pain where you have got some sort of associated, what we call is alarming symptoms. So the alarming symptoms usually when the pain wakes you up during the night. You know, in the irritable bowel or sensitive bowel, the pain usually does not wake you up during the night. If you are getting pain during the night and you're woken up due to the pain, you need to be worried about it. If you're losing weight, that's another alarming symptoms that you need to contact. Or if there is a family history of either any type of cancer, or you're bleeding in your bowel, or you're vomiting some blood. So these are the alarming symptoms which really you should not sit on, and you should contact your general practitioner immediately to be investigated.
Okay, that's absolutely fine. Dr. Ishfaq Ahmad is discussing abdominal pain and IBS, irritable bowel syndrome. And if you have any questions, anything, any experience you want to share with us, please do call us. There is a number on the screen, and there is different social media outlets you can use it to get in touch with us. Do call us and talk to us. Inshallah, we will respond to your questions. So, IBS, is that part of abdominal pain, or is it something totally different?
IBS is the part of the pain. If I can sort of explain a little bit more about the pain, that if you found any features, you know, the associated symptoms with the pain, like if somebody has got a peptic ulcer, so the peptic ulcer pain is relieved after taking food. When you're hungry, you will get more pain. And when you've eaten the food, the pain gets better. Because when we eat food, the stomach acid actually try to digest the food. But when we are hungry, the acid in the stomach is attacking the ulcer and causing the pain. And similarly, if somebody has got a problem with the pancreas, the pancreatic pain is usually relieved by sitting forward, leaning forward and sitting up.
Okay.
So that's another thing to remember. And if for some reason somebody is unfortunate, there is a rupture of any of the part of the bowel, then the patient cannot really move. Any movement will cause severe pain. So they need to understand these kind of associated symptoms. And also, you can sort of notice that certain kind of food gives you pain and diarrhea, like if you've eaten too much dairy product, that can give you diarrhea and pain. So you will know and understand that there is a association with certain foods as well.
Too much food, is that going to be a painful experience?
Too much food? Yes. I mean, last night I attended a party.
All right. I wasn't referring to you though.
and I did eat a lot of food. It was very tasty food, and I did suffer.
Yeah.
So yes, eating too much food, you are distending the stomach.
Yeah.
So I mean, the stomach is like a balloon. If we can
All right, okay.
focus onto this diagram. Yeah. So when we eat, this food passes through this tube, which is called esophagus, into the stomach. So the stomach is a sort of a mixture, you know, like normally we go to blenders. So similar, the stomach is a type of blender which blends the food. So more you put in, it's going to expand. When it expands, it's going to cause the pain. So I think too much food is also causes a pain.
So it's the problem, isn't it? Too little food is causing problem as well, and too much food as well. So
That's correct. I mean,
so it's balanced diet is the good answer.
balanced diet is a good answer. And also, I think these days there is a issue that people are now trying to eat raw food. They think it's healthy, like raw eggs, raw milk, which is not pasteurized, cheese, which is not pasteurized, raw vegetables. So I think these foods are notorious to cause infection. If you eat raw egg, you most likely will get salmonella infection of the gut, which is not the right thing. Similarly, drinking raw milk, which is apparently, I heard from one of my relatives, is being sold in Manchester.
It does. A lot of people actually buying it.
A lot of actually people are buying it, and it's unhygienic, it's unhealthy to drink raw milk. And it's being sold every day. And I was surprised that a couple of my very educated, well-educated family members, friends, they said, oh, we got a delivery of raw milk today. That is not right.
So are you going to tell me that whatever we've been doing in Pakistan, having raw milk, that wasn't good for us?
It was not good in a sense. The raw milk has got some bacteria in it.
All right, okay.
So when we drink the raw milk, then we are exposing our gut for infection, and the chances of infections are very high. Similarly, as you could remember from our olden days in Pakistan, gastroenteritis was so common, and it is still very common. So that is one of the causes, that we not eating the clean food or well-cooked food, or we used to drink a lot of raw milk, which is not really healthy.
Okay, that's absolutely fine. What about constipation? Is that could be cause of abdominal pain?
Constipation can also cause abdominal pain as well, and that can easily be mended with the dietary manipulation. You can use, if you're using the white bread, you can change to brown bread or seeded bread. And if you're using the normal cereal, you can start eating brown cereals. And also, depending on if you're not eating enough salads, fruit and veg, you can include that in your diet to improve your symptoms of diabetes. And also rice. I mean, we prefer white rice, is that correct? And you can change that to brown rice. The brown rice are more healthy, contains more fiber.
You can color them brown, or you need to buy. Okay.
You need to buy the brown rice.
But some people probably argue that, that you're used to having white flour for chapati, white rice.
Correct.
And they taste better.
They taste better, but they're not healthy.
Right.
But on the other hand, if you start using the healthy food, then the price you will pay is by gas and bloating.
Okay. So talk about bloating. What's the cause for bloating? Or shall we look at IBS first?
IBS first, yeah. I mean, it's actually irritable bowel syndrome. When I was training, I think I didn't see any patients. I'm talking about more than 30 years ago in Pakistan. But nowadays, I think the irritable bowel syndrome back in continent is very common as well. It is due to, I think, it's a combination of factors that stress do play an important role in irritable bowel syndrome. What basically irritable bowel syndrome is that there is no structural problem in the bowel. The bowel is perfectly in a prime position, There is no issues with the bowel, but the bowel is very sensitive, and it sends the message to the brain that whenever there is a slight distension. So the predominant symptoms of patients with irritable bowel syndrome is the bloating. The bloating is so common that every second person you meet in the street will have some kind of bloating. So the bloating then causes the pain. So going back to the irritable bowel syndrome, so there is actually no structural problem in the bowel, and there is no diagnostic test. Sometimes we get the patient, so can you diagnose my irritable bowel syndrome? No, we haven't got any diagnostic test. It's diagnosed based on your symptoms and exclusion of other conditions. Very common irritable bowel syndrome, about 15 to 20% of population, or 1 in 5 people have got irritable bowel syndrome. And fortunately, not everybody contacts the medical field or their doctors. You can estimate that about 50% of our consultation in the hospital is due to irritable bowel syndrome. If all the patients with irritable bowel syndrome in a community starts seeking medical attention, I think we would not be able to see any other patient in our clinics.
So technically, you have no job to
we will
to
have
go to.
No, it's actually a bread and butter of our clinics.
All right.
And fortunately, there are only 15% of the patient who have got IBS actually seek medical attention, not everybody. And those 15%, they are concerned that they may have some underlying serious condition. So basically, when they consult the specialist, we tend to sort of do some investigation and reassures them, and then start some kind of treatment.
Okay, just Dr. Ishfaq, while he's having a glass of water, we'll just let you know that we are talking to Dr. Ishfaq Ahmad, who is our special guest tonight, and we're talking about abdominal pain and IBS. If you got any concern, any question, please do call us. And I've been just told that Jamila Shahid, you've gone without her. You came without her, so
I'm sorry.
she's complaining. You know, she's just.
I'm sorry, Jamila was, she was with us
last time.
Last time, she did fantastically well on her first appearance, and I'm sorry I couldn't invite her today because the topic was totally different.
Okay.
Although some of the abdominal pain could be due to gynecological disorder.
Absolutely.
And I'm sorry, Jamila, I missed you. I wish I could have invited her.
Absolutely. Well, this is it. It's official complaint has been lodged now. So
sorry about that.
It's the stress you're causing to people. Is that could be part of IBS? Stress?
Yes, I mean the stress is a main issue or main problem in irritable bowel syndrome, and stress and depression are actually linked with irritable bowel syndrome. And once you start the treatment for anxiety, depression, the irritable bowel syndrome gets better on its own. And we do sometimes try antidepressant for irritable bowel syndrome, which proves to be better than a lot of other medication we use for this kind of treatment. And stress these days, unfortunately, everybody is stressed. Like I was stressed when I read when I sat nav that I will be arriving a little bit late.
That's stress, yeah?
That was stress.
And I was stressed because when I didn't see you here, I thought, God, what are we going to do?
And tummy was rumbling.
Yes.
That I'm going to be late again today for the appointment, although I left home well in advance. So I think the stress is very important. And as a matter of treatment, there is what we call as a cognitive behavior therapy, and which actually gives you a relaxation of your mind. And if you involve in some kind of relaxation exercises, like I think yoga these days is very good. Mm-hmm. And it relieves your stresses, and that usually is quite helpful for irritable bowel syndrome as well. But I mean, there is no way you can take the stress out completely out of your life.
Okay. So shall we move on to, before we move on to bloating and other issues, I think it's time to have a break. We're going to have a short break, but inshallah after the break, we're going to talk to our guest more about IBS. We're going to talk about treatment. We're going to look at special Desi style totke, home remedies. And I hope you have some as well, so we'll love to hear from you. So let's have a break, and inshallah we'll see you after the break. Assalamu alaikum.